So, welcome to another episode of She Conversations. I'm Ashley.
And I'm Tanya.
So, Tanya, how you doing today?
I'm good. Today is
Mhm.
one day until the weekend, so I'm good.
Busy week?
Busy week. Definitely busy week.
Yeah, I'm just glad it is Thursday. Tomorrow's gonna be a chill day, and like you said, it's the weekend.
Yeah, that's what I'm hoping for.
Yes. So, you ready to jump into today's episode?
I am. What are we discussing today?
So, I know we were talking and we've had some really great content, but I know we were talking that saying that it's important that we, take it to the basics and just talk about, some just HIV one-on-one stuff. Just for our viewers who may not be as familiar with HIV. I mean, we do this work every day, but, we do realize everybody doesn't.
Hmm.
Mm-hmm.
So,
Absolutely. And to broach this conversation, we have an expert from the field. I'm going to let him introduce himself.
Okay.
But what I can say is that I've met this gentleman about probably over 20 years ago when I first started in the HIV field. He's probably one of the first individuals that I met. And I just appreciate the friendship over the years. Um, he's he's a great guy. He's extremely knowledgeable when it comes to HIV as well as other things. But I'm gonna let him introduce himself. So you can.
Okay. Thank you, Tanya.
You're welcome.
Thank you both. My name is Alex. I am a health educator. I'm a group facilitator. I'm a HIV counselor, tester, and I'm a phlebotomist. And it takes all of those things right there just to do one service in the community. And they all work together in providing a service of education and informing the community about HIV. And that's what I've dedicated my career to over the last 20 plus years of educating youth, women, males, etc. I actually retired from the University of Maryland Medical System, the Institute of Human Virology, but I couldn't stay retired. So I stayed home probably about a year, and I instantly went back to work. So
I'm not surprised.
yeah, I'm back. I'm already. You have to, and
I'm
then
not surprised.
you just have to. You
Yeah.
have to. Nobody wants to just do nothing.
And whom are you working with now?
Actually, I work with a very local organization by the name of The name of the organization is Everything Must Change.
mm,
It's a recovery program based originally in Philadelphia, moved here to Baltimore. It's kind of ironic that a lot of the individuals that we sent to Philly years ago are back in Baltimore running recovery programs. Um,
That's awesome.
in this program, we probably have about 120 clients.
mm.
I specifically work with the reentry program. I'm the house facilitator for the two reentry programs.
Okay.
And yeah, that's what I'm doing now,
Yeah.
and I kind of like it. It's a different population, and that's what we're doing. And hopefully, I'll have some of my guys meet you or meet your crew if they are able to come out and at the first of the month
Mm-hmm.
to get tested.
Yeah,
Yeah,
absolutely.
I
Yeah.
gave them a little bit of information about it, but I ain't tell them much because I don't want them to all schedule appointments around the same
Exactly.
time.
I
Exactly.
know
We know
that's
the
right.
game.
I know
Okay.
that's right. Well, we're definitely happy to have you here today.
Okay.
And so, as we mentioned earlier, because we work in this field, we know a lot about HIV, but, that may not be the case for everyone. So we
Great
want to
point.
start off by just jumping into like HIV one-on-one stuff.
Okay.
So
Sounds
can
good.
you tell us what is HIV and how does it affect the body?
Well, good question, and it's a very good point that you make. We automatically assume everybody knows this, and everybody don't know this information. And I gotta say this: with the upset in the onset of the pandemic, the epidemic of the coronavirus, it kind of threw our focus off completely, as though HIV did not exist. And I think our numbers kind of got out of skewed, or probably what we'll find out in the next 2 years, that there was an increase during this time.
Mhm.
That's just what I believe. Now, what was that other question? What did you just ask me?
What is HIV and how does it
Bam.
affect the body?
HIV basically, it is the human immunodeficiency virus. It's a virus that, if untreated over a process of 10 years, will devastate and deteriorate a human's body.
Mm-hmm.
And just by even saying that, that's the importance right there of being tested.
Mm-hmm.
To interrupt that process right there, to early detection, early information, early knowledge. A lot of people say they would not want to know. And I thought I understood that at one point, but that makes no sense. You will want to know so that you can immediately do something about it, because individuals that know their HIV status now can live a healthy, productive, normal life
Mm-hmm.
as it relates to HIV anyway. HIV untreated, it just like in any other, just like back in the 80s, the same thing that happened today, untreated, it will ravage your body.
Mm-hmm.
A lot of the medications that we have now have not only eliminated, but checked all the side effects, the all the issues that are associated with HIV. So we really shouldn't see any bad effects of HIV devastation, especially in the United States anyway, because of medical care and medical technology, the advancement of technology.
Mm-hmm.
We should be safe, even as it relates to the eradication of women giving birth to HIV positive baby. Some of these things we should have eradicated, and it should not happen in the United States. But unchecked, uneducated, uninformed, it could slip through the crack.
Right.
Mm-hmm.
And the devastations would be just as bad, or if not worse.
Mm-hmm.
Or if not worse.
Yeah.
Yeah, absolutely. Um, if you don't mind, can you share like what's the difference between HIV and AIDS? Like some people may be confused.
HIV is the human immunodeficiency virus. This is the virus that causes AIDS. A lot of people will say, people say that they want to get an AIDS test, which is not even a thing.
Mm-hmm.
We are tested for the virus. The virus, untreated over amount of time, that virus unchecked will develop into AIDS. AIDS is acquired immune deficiency syndrome, which simply means that a whole lot of things within your immune system is going to go wrong. And that's because of the effect of being infected with HIV, that virus. The virus leads to AIDS.
Mm-hmm. Yeah, and thanks for explaining that because
And it's still complicated,
yeah.
but it's not. Yeah.
Mm-hmm.
Yeah.
Yeah, but I think that's helpful to know what you just explained to us because a lot of people don't know the
And it is
I guess the stages
Mm-hmm.
of it. So
Well,
there's a lot of misconceptions out there, right? So a lot of people still don't really understand how HIV is transmitted. There was I want to say there was a time, but that still exists today that people think that you can get HIV from touching, kissing, things like that, sharing like silverware, like that's still a thing. Like I feel like I've heard people actually say that. So can you please explain to our viewers how is HIV transmitted?
what you just said is so important and significant, because it's part of why I got into doing what I do, and that is to dispel, to eliminate the myths, the ignorance, and that's not a bad word. It means just not knowing, the ignorance that surrounds HIV, because the ignorance that would surround HIV leads then to stigma, which actually, left unchecked, could allow this virus to spread through our community even more so. Because of ignorance and because of acting as though it does not exist when it does. What was the rest of that question again?
No, just basically how it's transmitted. Just letting the
Transmitted.
people know.
Wow. It's transmitted from mother to child. It could be a vertical transmission, meaning that a pregnant mother could be infected, hypothetically be infected, not know that she's infected, and through the birth canal transmit HIV. That's just one way. And we got to be mindful of that. It's not always through breast milk, but it could be the vertical transmission with mother to child. Blood to blood, of course. When we talk about blood to blood, I like to say any blood to blood, but it's specifically sharing of needles.
Mm-hmm.
Wow. I remember a time where that was the primary mode of transmission of HIV. And over the years, working in this field so long, I've seen the modes of transmission, some decrease, some increase, and some stay the same. But right now, it seems as though one of the number one modes of transmission of HIV is unprotected sex.
Mm-hmm.
And that's a tricky statement. Unprotected sex comes in different categories, of course, because some sex unprotected, I would say, is more risky than other sex. But how do we categorize that? How do we say what is more risky? How about everything without protection is risky?
Mm-hmm.
So unprotected sex. Of course, I don't know if I mentioned. Yeah, I did mention the breast milk piece, and that's. But some of these things we still have to talk about because they still could exist. But in my mind and in my world, they should not exist.
Mm-hmm.
Some of these things in the United States, we should be way beyond. But we're not. Somewhere somebody is pregnant or have conceived without proper prenatal care and may actually give birth to a child in 2024 that it could be possibly born still with HIV somewhere in the United States.
Mm-hmm.
And of course it happens in the world. I kind of got off track, but
No, you answered the question. All important.
I really did.
You talked about unprotected sex, which I think is the number one
It is
mode
Isn't
of
that wild?
transmission
Isn't that
for
wild?
Black women, and then
Yes.
the very important the perinatal HIV cases and infections. So I think you touched on some pretty significant things that impact Black women.
But you just said something that made me just think about that situation. The risk that a Black woman inherently is in. The fact that she's a woman puts her at risk. Because she's a Black woman, of course, her economic, her social, I don't know if I like the words together. I like to separate them. Her social level, her economic level. We can call it her social economical level. It's the same thing. But they both deserve their own attention because they are both real powerful pieces.
And I'm glad you mentioned that because later on we're gonna
Okay.
really dive into
Okay.
that. So hold that
Okay.
thought.
I'll
Hold that thought.
I'll
We're
hold
gonna
that.
circle back to
All right,
that.
I'll hold that one. All right. Okay.
Definitely.
Okay.
So a little bit ago, you talked about testing and the importance of testing and early detection. So if we have any viewers that are wondering, like, how can they get tested or how often they should get tested, like, what would you say to them?
Wow. I don't know why I laugh. I laugh because individuals, I think everybody should be tested. It's supposed to be based on your situation, kind of. If you're in let's say, even if you're married and y'all in a committed relationship, how often should a married couple get tested? That is the best question ever. I like to start there because I like to say, I really honestly like to say every 6 months to a year. I know that's ridiculous. That's ridiculous. Most people think that's unheard of. Why would you have no, really, why would someone who you're married to, why would you have to be tested for HIV every 6 months to a year? Because I just believe in being ahead of the curve. If something goes wrong, I want to be ahead of it. And the reason I say that, because I've done this work. And as an HIV counselor and tester, I've diagnosed married couples.
Mm-hmm.
I've seen how even the institution of matrimony sometimes is not sacred. And that does not particularly protect you from HIV. And then a lot of times the Black woman is even more at risk unknowingly because her partner may have had questionable behavior. Questionable behavior, even secretly using IV drugs. That's questionable behavior. Now, that questionable behavior could go deeper, but we all understand that. And that also puts a Black woman who really loves her partner at a greater risk,
Mhm.
blindly, almost willingly, but blindly at the same time. It's like that statement, eyes wide shut. Wow. Wow.
Mm-hmm.
Imagine that. No, we have to work with that one. I've heard that statement at a conference years ago, and it never left my mind. How it could be right there in front of us and we could miss it. And then I've had arguments about that same topic with married couples, and where they would not. Some people don't believe that there actually could be that there's risk. Anytime an individual has unprotected sex with another human being, it's risk.
Mhm.
But of course, you guys know that's one of the trickiest things to try to counsel someone one on. Not only their sexual behavior and their sexual appetite, drug using appetite. Who do we think we ought to try to change these behaviors? But we do it. We try. We try.
Mhm.
And we continue to try. And I do believe the more that we come together and the more that we continue to try, we are making a difference.
Mhm.
And we will make a difference. You know, even here in Baltimore City, I just want to throw this out there because I was looking at some of the numbers. The the incidents in Baltimore over the last few years have gone down. Incidents meaning the reported new cases.
Mhm.
Let's just keep it simple for those me listening. Those cases that the new cases have gone down. To me, that's a big deal. Even if it went down by 5%, 1%, I don't care. 5 people, I don't care. If it's gone down at all, it's a good thing. It's a testament to the work that a lot of us do every day in the community.
Mm-hmm.
Wow, you have to
Yeah.
stop me. I will continue. So,
You're
No.
fine. Cause no, you made some good points, like talking about testing and people not
oh,
understanding what you said. That anytime you have unprotected sex, you're at risk, and the importance of testing. So that's important to highlight.
and even watch this. If someone, as a counselor, if I'm going to counsel you correctly, even if you tell me that you use protection, I am still going to say you should still get tested at least once a year. It's just going to be my rule, and I mean it, and I
Yeah.
believe it. And it's a lot of reasons I personally think that a person could still be at risk, whether they know it or not.
Right.
That's how bizarre my mind is
Yeah.
with this thing.
And then I know we were talking a lot about HIV, but I feel like you can't talk about HIV without talking about other STIs like
Mm.
syphilis, gonorrhea, chlamydia. So, what's the relationship between HIV and other
Well,
STIs?
it's a direct relationship. It's behavior.
Mhm.
It's behavior. And that's it right there. Our behavior must change, and we must be in touch with our behavior. We must be able to be educated. It's direct correlation. It's direct connection. And these are STIs. They travel together. Down to Hep C,
Mhm.
they all travel together. Usually, if an individual has one, he got several, and they have to deal with that. And it's a big deal. So information and education, I do believe, sounds so old school, but information and education in the community is key.
Mhm.
Talking. I believe in this right here. I believe in talking amongst us, putting that word out in the community. If 5 people hear it, if 10 people hear it, and they share it with 5 or 10 other people, we did. If 2 people heard this, we did a good thing.
Yeah.
So information and educating the community, people changing their behavior just by hearing.
Yeah.
Yeah,
Absolutely.
yeah.
Absolutely. And so we talked about, what HIV is, how it's treated, testing. Um, so I know earlier you talked a little bit about the different treatment options and, how far we've come. Can you talk about some of
Oh
the,
wow.
the current treatment options?
Oh, I mean, we've come from a point of medication for HIV. Taking people were taking 17 pills a day. Of course, that is no longer the case. We're down to in several different regimens, but the majority of pills an individual may take for their particular regimen it may be 3 different pills. And the reason I won't name 3 different pills because it's a whole lot of different combination of those pills. But the treatment for HIV right now in the United States, in the world, but in the United States, is, I believe, at one of the highest points ever. If a person is tested, diagnosed, and that's the importance of being able to test in the community so that you can diagnose individuals early and get them in care. If you get a person in care, it's like an 80% chance that a person is tested, diagnosed, educated about their status, and put and directed into medical care won't hurt another individual.
Mhm.
So that's work right there with that one person. But we do that all day long for years, all day long in the community for years. And that's how we make a difference. So I don't know what the initial question is. What was it again?
Just the current treatment options. Like
Oh,
I know something that we're hearing a lot more of now is
wow.
the long acting injectables. Can you
Wow.
speak a little bit about
Oh,
that?
I've heard about them. I don't know a lot personally from a medical perspective, but what I do know about the long acting injectables is that they allow individuals a newfound freedom.
Hmm.
A newfound freedom to do medications and taking medications 100% prescribed, just like the doctor said, is very hard to do. So if you can get a medication that's safe, that can treat HIV safely without hurting you, that can last 3 months, it's awesome because what it does, it eliminates the human error of forgetting to take the medication.
Hmm.
And the whole goal is to take the medication to a point that you are undetectable, meaning that there will be no medical equipment that will be able to test or detect the amount of virus in your blood.
Hmm.
And that's the goal. And if anything could help us achieve that, if any medication or the injectables personally could help an individual reach that goal, awesome. Other treatment options, study treatment options. No, no, they're not actually treatment options, but other ways of dealing with this issue of HIV is with like PrEP. I don't know if I want to call it a treatment option. When I think of it, it makes me laugh. It's not. It's a treatment option before the problem.
Hmm.
And PrEP, as if anybody doesn't know, it is pre-exposure prophylaxis. That means that we're going to take some medicine. We're going to take HIV medicine before we go to the wild party, just in case if we drink too much and have too much fun, and we don't use protection or the protection breaks or something wild happens, I still got some medicine in my system that could possibly help fight this off. That is a crazy way of explaining it, but that's about it.
Hmm.
And I think it's another key option. It may not be a key option for everybody, but it is an option for certain lifestyles. Certain lifestyles, I actually would recommend it. Yes.
Mm-hmm.
And I don't recommend taking medication randomly, especially expensive medication. But if a lifestyle says that this may want this type of preparation in advance, yeah, let's do it. Yep,
Mm-hmm.
yep.
Yeah, yeah. Are there any other type of preventative methods you would suggest? I know PrEP is one. Were there any other ones that you
I mean,
would suggest for
it's
people?
not a suggestion, but it's what and I worked in the ER for many years, and I love working in the ER. And you see, um, just the opposite, the post prophylaxis use, where someone really felt as though that they know they had an encounter, they know they had unprotected sex, and they know it was an issue. And they're freaking out, and they want to take medicine right away within the next 24 to 36 hours, or HIV medication to try to stop anything from actually taking root in their body or starting to develop in their body. I think it's an option. I've actually have done it in the ER. Yeah. I
Mm-hmm.
mean, it got to a point. Well, I've gotten to a point, and I think I am. I will do anything to stop the spread of HIV.
Hmm.
It's just my thing. It's
Mm-hmm.
what I do.
Yeah.
Yeah.
So I know earlier, we started to talk about and you shared some information about the impact of HIV on Black women.
Hmm.
So we know statistics show that Black women are disproportionately affected by HIV. So based on your experience, your work in the field, your engagement with Black women, why do you think this is?
It's the same way with breast cancer and other issues that disproportionately affect Black women. It has to do with seeing this as simple as seeing a primary care on a regular basis, some preventive work. We do a lot of sick care management in the United States. When you get sick, we'll work with you. But a lot of other communities are able to get preventive care. Preventive care is important. Preventive care will change the game. And a lot because of, again, social, economical factors, Black women may not all, sometimes the ER is the primary care, and that's not going to get it. And we start having gaps in the system like that. And the care is not, and overall, the care is not given out properly as it should be. It's all about, it has a lot to do with finances. And that's with everything. And education and information, because a lot of times with the correct information, you'll find a way to make something happen. A lot of individuals just don't have the correct information. And that's why what y'all doing is tremendously important. Because a sister may get something from this that she wouldn't get somewhere else. A Black woman. And I had my mother was a Black woman. I lost my mother to HIV in the 80s and my father. So this thing go way back for me. This fight is like embedded in me. Yeah. So I understand her plight too, and how much she loved my father to death. She loved him to death.
Mm-hmm.
So yeah, and she was one of the most, check this out, intelligent people on this planet. So sometimes it's who we love. And it's not that we are not smart people or women are not. It's who y'all love sometimes. Sometimes it's that. And sometimes if he isn't taking care of himself and if he isn't doing the right thing, you may have, even if it's my father, dude might have been around dude to be loving. That's all. I don't want to go down that rabbit hole too deep.
Yeah, no, that's
Yeah,
important.
yeah.
Yeah,
Yeah.
everything you said, no,
Yeah.
that's definitely important. And now, since we mentioned that, if you were, say, out in the community and you were having conversations with the ladies, what type of resources do you provide women in relations to HIV, whether it's emotional support or medical support or whatever they may be looking? Are there particular resources you provide?
For the longest, I am and was and will always be a referral specialist. Over the years, if I haven't done a referral in 6 months, referrals and resources change. In a year, they change tremendously. But one thing I know, and this sounds kind of taboo or whatever, but one thing I know that's real consistent, and that I know these guys are real professional, and they've been consistent as long as I've been doing this, and that's Baltimore City Health Department. People overlook our health department because of the clichéness that comes along with the title of the health department. But the health department has made and saved a lot of lives in this city. A lot of times, a lot of the organizations, the community-based organizations in this city, especially those that I'm aware of that were there for women, the stronger ones, they come and they go. Uh, there are others that are still there. Star, Sisters Together and Reaching, they still exist, but in a whole different capacity. Matter of fact, I'm thinking about doing some work with Randy if we could figure out schedule and time to help her train her community health workers, and they're doing something on a different level. But organizations like Star, the health department, even people don't realize it, but Debbie Rock got a whole program up there, Light Health and Wellness. It's some very key jewels in the city that's been operated by black women for many years and still is operated by black women, with the exception of, of course, the health department. But the health department is the health department. That's our baby. That's the city's baby. So there are resources even if a woman does not or a person does not have primary care. And these resources could help you and guide you to the care that you need for long term. Yeah.
Mhm.
And if an individual is living with HIV, there are tremendous amount of resources ready for you just because of the way that the funding streams run. That money is strictly for HIV Ryan White clients. So that's a whole nother conversation.
Mhm.
It's a whole lot of conversations that could come out of this one conversation.
Mhm.
It's a whole lot of different stems and branches of this conversation. And this black woman piece is so embedded because if we don't take care of the black woman, we don't take care of our children, because that's who take care of our children. Matter of fact, the black woman take care of me, the children, the house, the dog, and everything else. I know that. So I know that we have to take care of the black woman.
Yeah. No,
Wow.
absolutely. I definitely agree.
Wow.
And that actually is a good segue into our next question.
Okay.
In thinking of taking care of the black woman, how can, in your opinion, how can medical providers and even community healthcare workers do a better job of providing services to support black women? I mean, we talk about a lot about the lack of culturally competent care. So in your opinion, what can be done?
One thing that can be done and that has been done, because I was a part of it, are programs. When you work at universities like Johns Hopkins, University of Maryland, you got always a stream of nursing students and medical students coming in. They're usually not from my community, but they're going to work in my community. Whoa, it's a mismatch. So what you do is this, in my opinion, is part of their curriculum as first, second year nursing students, first, second year, way before graduation, medical students, send them in the ER. Send them with, they have to become culturally competent and experience us on our level. They have to experience a inner city ER on an inner city ER's level and understand the individuals. And they need to sometimes work with individuals that understand this population so they are taught how to interact and how to deal with the population, because a lot of medical professionals don't know how to interact properly with the population that they're there to serve. And that's a disconnect and a problem right there. So I think part of bridging that gap is to start to train the medical professionals even on how to be a bit more culturally competent.
Mm-hmm.
We have to. It's a must. We did a program called Preparing the Future where we did exactly that with medical students. And I would take 3 or 4 medical students with me as I went room to room to room testing people. Cold, bust in your room, just test you. And you get all kind of reactions from black people when you walk in a hospital room when they sick, talking about HIV testing. But that's what I wanted. And I wanted them to see that. And I wanted them to see how I was going to deal with it, because I never knew.
Mm-hmm.
But it was a beautiful experience, and it's a beautiful learning experience. But it has to be done. And it has to be a conscious connection. Somebody in that hospital has to say, these guys need training from ground level. We can't just take these students from a different population, put them in medical school, and then tell them they're going to serve a whole different, still a new population. It's always going to be a disconnect. The disconnect has to disappear.
I definitely agree. I absolutely agree. And before we move on to the next question, so I know you talked a lot about medical students. What about these medical providers who've been in the game for a while? Like for us as an organization,
Ooh.
a part of our services in the future is connecting with these providers. So how would we connect with someone who's been practicing for like 20 plus years who may think they know everything and they don't need any new, any culturally competent trainings.
You approach them, in my opinion, the same way, or maybe a bit more tact and gentleness, but the same way you would approach me or anybody else. They got to get this information. So you have to adjust your approach as a communicator so that they'll receive you.
Mm-hmm.
Because people's lives, check this out, people's lives are on the line depending on whether they receive you or not.
Mm.
They have to hear this. It ain't like we got a choice. They have to understand. So if that means I have to come in and be a bit more gentle, or to play myself sideways to get them to open up. Some individuals have fragile egos, and I have to take care of that too. You know what I mean? And as black women, I'm sure not only are y'all used to fragile egos, but y'all probably are very used to fragile male egos. You have to like really be a artful and a skillful individual to deal with these older providers that think they know everything, because they are very dangerous.
Mm-hmm.
Yeah, that part.
Yeah, that part right there. We gonna leave it right there. Put a pin in that.
Yeah. So you've already talked about HIV from an individual level. We talked about institutions. So now let's talk about from like a community level. How can like communities work together to kind of reduce HIV, or to kind of better support those living in those communities with HIV?
And so this is black everyone living with HIV, not just black women.
Mm-hmm.
What was that question again?
How can communities like work together
I mean,
to kind of reduce HIV?
if you have a community-based organization and a community-based organization and another community-based organization, then you have the health department. Somebody has to communicate. I've seen years go by where this organization never talked to this organization. I've been a part of that because we was really busy over here. We really didn't have time to talk to them, and we didn't want them to know our hot spots anyway. And it was numbers that we wanted. We didn't want them to know what the numbers were. It was always that. I know that sounds terrible. I said it. Whoops. I said the number game.
You speaking
Oh my
truth.
gosh.
This is something we already know about.
I didn't mean to talk about the numbers, but that part, we have to be cool with that. I don't know how to get past the numbers because we operate, we eat, we pay our rent from the numbers. The numbers are what provide our paycheck. So how we have to come to a point where everybody is okay with working together and securing our paychecks together and the community. I've watched Star work with the health department. I think because so many of us was just from the same organization and we could just pick up the phone and call each other. And if it was an event, we could be there, they could be there. Sometimes both mobile units could be there. And that was never a hard thing to coordinate back in the day. But it took, I don't know, I think it takes a special person to make that happen.
Mm-hmm.
And we have to be special people. And we have to be the person. I can't survive in a community testing people. I better not test you. Because if I test you, I might have to diagnose you. And if I diagnose you, I better need to have somewhere to take you today. Medical care today, whether you have insurance or not. I need to know that 2 days in advance before I test you. Before I even touch a test kit. How dare me open a test kit and don't have nowhere to take you? Nah, that's bad business too. So I need to have all of these things in alignment in advance. And it's real important for me. If I'm going to go out and test on Friday or Thursday, that on Monday, I'm checking my resources and my connections in the community. And I'm establishing new ones. We have to make, what they say, on purpose. We have to do that thing on purpose. It won't just happen. I used to wait for it to just happen. Ain't nobody ever called. Everybody just kept their numbers to themselves. So, but once you call, I remember it was another organization. What was that? Bernice Tucker. What was her organization? Oh, okay, I won't bring it up. I forgot. But we did work together at one point in the city. But then all of a sudden it just stopped. Numbers and money got too funny. When the money got funny, we had to stop that because everybody had to defend their own money. That's what it was. There you go.
And that's
Spill
not
on the
talked
tea.
about enough. I
Mhm.
Wow,
mean, that's not
that
that
is a horrible
competition,
situation.
right? And
Mhm.
yeah, it's a
Mhm.
terrible
I never
situation.
talked about it openly.
It needs to be talked about openly because it's happening.
Yeah, it
Mhm.
happens. I thought it would go away though.
Yeah,
It
that.
didn't.
Nope. When
Wow.
funding and money is on the
Yeah.
line, like you said,
Yeah.
it's a competition. So
Wow. Yeah. That's real.
I feel like that's a whole nother conversation for a different day.
That and it is, and that has a lot to do with the whole process of getting people the care they need.
Mm-hmm.
That's a impeding situation right there.
Yeah, absolutely. Absolutely. Well, this was definitely a great conversation. I feel like we can go on and on about this topic. Any like final questions or anything? Tanya, anything you can think of?
Trying. Nothing comes to mind at this time. But yeah, just like Ashley said, I feel like it was a much needed conversation and well presented. So definitely thank you.
I mean, we just touched basically the tip of it.
Yeah,
Mm-hmm.
the
And I
surface.
thank y'all for doing what y'all doing. I don't even know how y'all started it. Y'all should be commended. Y'all don't even get it how important it is to teach and to get the word out and to use this equipment to teach. I don't even know how it's going to work, but I know it's going to be powerful because anytime you can do something to on the next level, and that's what we have to do. This is so much more creative than anything I've ever done in the past.
Mm-hmm.
Really,
Yeah,
I just needed 100 people in the room, and I was happy.
I know that's
That was good. I don't know nothing about
right.
a podcast, but this is so effective and it's new and it's different and it's technology,
Mm-hmm.
and this could be shared over and probably over and over again.
Yeah.
Wow. And every time, if you reach one person, you're doing your job. If you reach one black woman, if you reach one person, you're doing your job. You did way beyond you. If we help one person, if the three of us help one person through this conversation or through our careers, right?
Mm-hmm.
We've done our job. One person. So we probably good. I'm not sure. I'm not sure. I'm never sure. But I think we good. But we got to keep trying.
Yep. We got to
Mm-hmm.
keep trying.
We got to keep trying.
We got to keep going. We got to keep being innovative. We got to keep just reaching people.
I
So,
love the innovation. That's the
yeah.
word.
Yeah.
Innovate.
Yep.
So, Tanya, what's the word of the day?
So our word for today is innovation. So innovation is a new idea, a new method, um, or a new something original.
Okay. I like that. I like that. So, thank you for joining us for another episode of Chi Conversations. Be sure to subscribe, like, and follow. And until the next time, take care.
So I hope you enjoyed the episode with Alex. But we have some additional content that we wanted to share with you just to make sure some things are clear. We want to talk a little bit about some of the STIs. We're going to talk about syphilis and gonorrhea and chlamydia. And also wanted to share a few words on PrEP and NPEP, right?
Yeah.
Yeah, so I guess I'll start. I could talk a little bit about syphilis. So syphilis is an STI, and there are different stages to syphilis. There's primary, there's secondary, and there's tertiary. The way syphilis presents itself is as a painless sore, right? So that sore does show up any place where you may have came in contact with someone that was syphilis positive. So if it was in your genital area, if it was, I don't know, in your anus area, wherever you came in contact with that sore is where your lesion would appear. What happens is eventually it tends to go away, and you'll think, oh, that was nothing. It didn't hurt. It went away. You think you're cured, but without treatment, you are not, because it will resurface when it comes back. It can come back differently. It can come back um, as a rash. It can come back a variety of different ways. So the key with syphilis is, of course, treatment. Seeking seeking a provider that can provide you the treatment, the penicillin that's needed to get it cleared up. So I wanted to share that with you. also touch on a little bit about gonorrhea as well as chlamydia. Again, both for STIs, both can be treated through antibiotics. They usually, the symptoms usually are um, discharge, occasionally, maybe pain during urination. Um, some individuals don't have any symptoms at all, but those are some of the common ones. And of course, gonorrhea, chlamydia can both, they can show up wherever you were infected. So if it was in your throat, if it was in your vaginal area, rectal area, penile area, it can show up in all of those places. So um, again, treatment is important. And if you have any partners that may have not been tested, it's important for you to have those conversations with them so that they can get treated as well. Because it's a thing, if one's treated and the other is not, then you would pass it kind of backwards and forwards between the two. So just wanted to share those three things with you.
Yeah, and we also want to highlight, so Alex mentioned pre-exposure prophylaxis or PrEP, and so this is a medicine that you can take if you're HIV negative to prevent from getting HIV, and so this comes in the forms of pills or a shot. And so if you're interested in PrEP, we do ask that you talk to your healthcare provider. Also, most insurance carriers cover PrEP. There's also copay assistance programs out there, and so we'll drop some resources that you can use if you're interested in PrEP. And then also PEP, post exposure prophylaxis. So if you feel like you've been exposed to HIV, there is medication that you can take, but it has to be taken within 72 hours of exposure. And so, again, we'll include some resources for STIs, for PrEP and PEP. And so, yeah, those were some of the things we just wanted to follow up and highlight with you guys.
So, Ashley, I think that it's important to mention about the Standing Order program here in Maryland. I know they kind of use NPEP and PEP kind of interchangeably, but the same thing for the pharmacists having standing orders to where if a person presents to the pharmacy and they may have had that exposure within the last 2 hours, giving them the prescription to the medication to where they're able to, I'll say, not be infected if they complete the medication. So just important to note.
So, thank you again for tuning in. And again, we'll drop these resources in the caption below.